In this video, we'll be discussing beta blocker treatment pharmacy measure. The patient population that falls within this category of pharmacy measure are patients 18 years of age or older during the measurement year who were hospitalized and discharged at some point from July 1st of the year prior to the measurement year through June 30th of the measurement year with a diagnosis of acute myocardial infarction. The numerator for this measure are patients who received persistent beta blocker treatment for 6 months after discharge from the acute myocardial infarction event. Compliance is measured by at least 135 days of covered with beta blocker prescription during the 6-month post-discharge measurement interval. If a member has more than one episode of acute myocardial infarction during this measurement period, only the first discharge is assessed for compliance. The documentation requirements for this pharmacy measure are as followed. Measure performance data is collected from prescription drug event data, and we must document any intolerance or allergies to beta blocker therapy. And for patients on beta blocker prior to admission, those prescriptions are factored into adherence rates. The chart you see on this slide are the beta blockers that fall within this category and the medications that fall into those beta blocker categories. So some of the best practices to address this pharmacy measure is 1, outreach patients with prescriptions that have not been filled. 2, educate patients on the risks of not taking their medications. Discuss any potential side effects and management tips. 3, discuss any barriers to medication adherence. Advise on use of pill boxes and setting reminder alarms to help patients remember to take their medications. Utilize or distribute Arizona Care Network cost-saving resources for medications to assist patients to minimize cost, including providing patients with a 90-day prescriptions, prescribing generics, and using savings or assistance programs, for example, GoodRx. And lastly, our care coordination team can provide patients with individualized support. In order to refer a patient, please contact us at 602-406-7226 or 1-855-218-3451, or you can email us at the following email address. In order to increase your performance, always work with your CPC to educate your team. Build workflows to chart prep and identify open gaps before a patient comes in for an appointment, and always be aware of Arizona Care Network resources that are available to you. First and foremost is your CPC and the education and support they provide to you. Quality measure tip sheets that are available on the Arizona Care Network website, Arizona Care Network provider portal, and lastly, our Arizona Care Network Care Coordination team. Please visit the Arizona Care Network website for updated 2024 tip sheets. The picture that you see on this slide is a picture of the tip sheet that's associated with beta blocker treatment pharmacy measure, and you can find this tip sheet on Arizona Care Network website.